My prayer every day is, Lord, you help me to be a doctor, but above all, you are the mighty healer. Help me heal people. Let it be through you, by your spirit, by your power, either by my words, my actions, just my smile. Let me bring some hope.
This issue, we're very fortunate to have Dr. Yvonne Kangong, a respected physician, mentor, advocate, life coach, churchgoer, community builder, and the mother of three. Besides teaching at the University of Calgary Medical School, she's the medical director of the Mosaic Primary Care Network. She's also an advisor for medical research and the owner with her husband of a BBQ Smokehouse. Most recently, she has written a book, What's Obesity Got to Do with It? Yvonne, I've been looking forward to getting to know you since we met you at a lovely event a couple of weeks ago in Calgary.
I've been looking for it.
Well, look, I wanted to find out a little bit about your background, your family, and a little profile for those who don't know you.
Yes, I am Yvonne Kangong, married to Mr. Wilfred Kangong, wife, mother of three amazing kids, Elizabeth, Solomon, and Ariel. I am a Christian. My husband's father was a pastor. My grandfather was a Presbyterian pastor. My daddy and my mom, they used to sing in the choir. So I grew up in a Christian home. So to me, faith is very important. And we're raising our kids in the same way, following the Lord, because you can never go wrong with that. And I was so blessed to be married to my husband, whose family is also a Christian.
Mm-hmm. And tell me a little bit about your training and how you got here.
Yeah, so originally from Cameroon, West of Africa, at the age of 11, I felt led. I knew that I was going to be a doctor. I didn't know how. I was still in Cameroon. We had a neighbor who was a gynecologist, and I used to sneak by his clinic to see what he was doing. And one day, I got caught by the people working there, peeping through the holes while he was doing some exams, and I got a big crack on my head. I will never forget that. And so he saw that and he told him, don't do that. So he came to me and he said, so tell me, why are you so interested? Yes, I want to be a doctor. I told him, I want to be a doctor like you. You know, his name was late Dr. Biaka. May he rest in peace. So he really inspired me. And fast forward, I went to do microbiology in Nigeria, Abubakar Tafawa Balewa University. That's way in the north. And during my holidays, when I came home, I would go to his clinic. He had a laboratory. And so, since he knew I was interested, he would let me work with the people in the lab. And so he just helped, you know, develop that interest. And my mom was also a midwife um, and a nurse. And so she kept saying, you know, I think you'll be good for medicine. I think you like it. So she really supported me also. So then I graduated from Nigeria, went to St. Lucia, West Indies, where I did my medical school, and later on came to Calgary, where I did my residency in family medicine at the University of Calgary. And in between that period, I also got to do my master's in public health from Leggett University, and that was online. So in between all the time, I met my husband, we had our kids, and also I did a master's in public health. I did mention earlier on from Lakehead University. And so I started working at Better Children's Hospital as a research coordinator. And how did I get to this position? I started volunteering. So I always tell people it's good to volunteer because you never know who's watching you. So I volunteered at the Alberta Children's Hospital Emergency for research projects. And someone just asked me one day, what's your background? And I told them, like, okay, send me your CV. So I sent my CV. And fast forward, when it was time to apply for residency, I started taking the exams. I took the exam the first time. I failed. I told my husband, oh, I'm done with all this. And he's like, no, 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 no. You didn't come this far to let it, you know, to stop. We're also getting ready to move to South Africa because it was so hard to get into Canada in the Canadian system. And so we went to church one day. Then we're going to St. Andrew's Presbyterian Church here in Calgary. And I'll never forget this. Our congregants, like, they came to us and we said, they said, we're praying for you people. You would stay in Canada and God will open doors for you. And I looked at my husband, I looked at him like, oh, okay, God, what are you trying to tell us? And so we kept on going, kept on trusting God, kept on working hard. And at some point, I had to leave Calgary, leave the kids home with my husband and the nanny to go all around Canada to get the Canadian experience for almost a year and a half. Those were really difficult times, but I did it because God was with me and God was with my family and kept us all going. So I graduated from University of Calgary, and my preceptor, then Dr. Crutcher, Rod, who's also happened to be Christian. Tell me, God aligns you in places for people to inspire you and guide your paths. So he was my residency preceptor. He was a Christian, and there were times that I would come looking so devastated with the stress of residency, and he would call me in a room and say, "We got to pray." So God lined Christians along my path until today. He's still my mentor. I will still always reach out to him, for support. So I graduated from University of Calgary. He was retiring, and he said, "I think you'll be a good fit to take over my patient panel and to continue training residents." And I was like, "Who, me? How?" He's like, "Yes, you. I think you can do it." So I graduated in June. By July, I was a preceptor, a clinical lecturer at the university. So if not for God, where would I have been? So then after that, I continued in the community work as a family doctor, and then a position came from the Mosaic Primary Care Network Board of Directors. So the board of the Primary Care Network, the government gives money to community physicians based on the number of patients at the panel to take care of the needs of those patients. Let's say mental health dietitian or kinesiology. And so they have a board that kind of a non-profit. And so I was on the board. And after being on the board for a while, I became the assistant medical director. And now I'm the medical director. And so we have about 370 doctors and about
Did I
170
hear you?
staff.
Did I hear you say 370 doctors?
Yes, so we have 370 doctors that are part of that primary care network, and about 170 staffs, name it nurses, medical office assistants, pharmacists, all of that. We work together to provide the needs for those patient population. And I only look back and I say, it's only God because I can't do it on my own. I had years got in my resume whereby people would look when I went for residency interviews. They asked, "Where have you been all these years?" I told them I worked in the call centers, I worked in factories, and I was grateful to God I was fertile and I made babies during that time. And I think for me that was the icebreakers during those interviews. So here am I, just me, a little girl from Cameroon, a lover of God, and God has taken me to places I never could have imagined.
So you've gone from Cameroon, not even knowing if you could get into any kind of professional opportunity, to now being the medical director of a pretty big medical initiative, teaching medicine, right? You've also raised a family or raising a family, and written a book, which we're going to talk about. And you've even started a barbecue business.
My husband is the brain behind the barbecue business. Yeah.
In all these situations that you're talking about, you had a plan. You weren't sure if your plan would come through. And then other times, you didn't really have a plan for something to happen, but yet you somehow discerned God's will for yourself, for your family. How do you do that, Yvonne?
Prayers, meditation. I'm blessed to have a wonderful husband who's very God fearing, whereby
Mm-hmm.
Wilfred is his name. Where when my faith gets shaken, he holds me and say, "Hey, listen, He always says, let's take a journey back. Let's look back where we were before. Look at where we are today. If not for God, where would we have been? And that's when I go, oh, yeah, if he did it then, he would do it now. So
Mm-hmm.
I always say you need that community of faith, people that would hold you when you're falling, because you can't do it on your own, right? Yes, we know we're Christians, there's a Bible, but sometimes we will look back and say, why me? Why me? So I've got to a point in my life where I say, why not me? Even Job, the follower of God, he had the worst. Every time I read the book of Job, I go, oh, wow, would I have kept on following God? You know what I mean? Everything that he went through. So every time when I feel like I'm getting overwhelmed and I ask that question, why me? I say, why not me? If Job
Mm-hmm.
could still say, God, I'll keep on following you.
Mm-hmm.
I haven't even seen one tenth of what he went through. Why
Mm-hmm.
not me?
Mm-hmm. Now, I understand you've got a book about obesity. I can see it just over your shoulder. And I
Oh,
wonder, why would you write a book about obesity?
yeah.
And what is the purpose of this book, Yvonne?
Oh, the purpose of this book is to shed a light on the stigma and bias faced by people with obesity. Growing up in Cameroon, people with obesity were called names, fat, chubby, and and people feel like people with obesity are lazy. All they do is eat, 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 sit. And I did have a patient at some point who passed away because she had obesity. She had some other medical conditions that everyone blamed it on her weight. So that was an eye opener for me when that happened. I said to myself, I need to do something. I need to do something because the death would have been preventable. And so during the pandemic, I also changed my lifestyle. I gained some weight. And then during the pandemic, I said, well, I have a lot of time right now working from home. Let me try and see what I can do, to better my life. And I can also share that with my patients. So I took some time and I did the American Board of Obesity Medicine diplomat. I passed that exam and I said, oh, all the knowledge I've learned, let me write a book. And that's where how this book came about. So it talks about my struggles with obesity, like any other woman out there, whereby you have kids, you get pregnant, you gain weight, you find it hard to lose. Just when you think you're done losing that weight, you get pregnant again. It's like that little cycle. You wake up in the morning, you look at yourself in the mirror, and you go, oh, now what happened? Nothing can fit. So the way the book starts is pretty interesting. It starts about it's Friday. What a difficult week it's been. Juggling work, family, driving kids to sports activities, creating time for self-care. Time to take a break. But first, what am I going to wear? I looked around the closet. My jeans didn't fit. What happened here? Does this sound familiar? That's the story of most women out there. And also, there's some men also who've had like different challenges in their life. So I talk about the causes of obesity, what we can do as a whole, what policymakers can do as a whole, treatments out there, and genetic causes of obesity, and all the other medications out there, just some evidence-based research for the nerdy people.
Mm-hmm.
And just 30 tips to a healthier you, just little things that you can do a day at a time to just move towards your healthy goal.
It seems to me that part of this is about good medical or good health, common sense types of things, but it's also about inspiring patients, encouraging them to not give up, to persist if they fall, to pick themselves up, because we're bound to lose weight and then put it on again.
Exactly.
There's a psychology, maybe even a spirituality to this, because we look to God for all things. And who knows, maybe
Mm-hmm.
if we pray for our health
Oh
or
yeah,
others pray for our health, God can help us deal with that too.
exactly. One thing I also emphasize in the book is There's also science behind weight gain. It's not only willpower, right? Because sometimes people say, "Oh, if I could just eat less, I'll gain the weight." There's also this. There's always this: eat less, move more. They eat less, move more. It's time to put an end to that because yes, somehow lifestyle changes account for about 5 to 10% of weight loss. Then there's the genetics, which is if you have two parents with obesity, you have about 70 to 80% chance that you have obesity. So there's so many odds against us. Sometimes certain medications people take, even blood pressure medications, medications for birth control pills, with medications for depression and anxiety. There are also different medications that can lead to weight gain. So it's a whole comprehensive approach that I take in my practice, where I look about around the behavior, physical activity, medical nutrition therapy, then there's the medication, and then there's also bariatric surgery. So I tell people it doesn't make you weak to get to that point to say, you know what, I need the support.
You are talking about men and women, but I know women are important to you because you spoke
Mm-hmm.
at a wonderful event which was honoring women, calling them women of
Yes,
distinction, in which
yes, yes.
you recognized those many women who were given the award. Why do you think it's important to do something like that?
I think I like people to see where I've been, to see that if I can stand here today, so can you. Because women, we have so many challenges. When we go, before we go to bed, we're already thinking about the next day. What are we going to eat? What are we going to do? What is this? Oh, this child has this child has this. Not that daddies don't do that. No, daddies do that too. But we're just wired to think way further. And so if a wonder woman sees me standing there and giving them that hope, I just think it's so important. And the
Mhm.
African proverb that says it takes a village to raise a child, it can take a group of women to inspire younger girls growing.
That's something we don't see in Canada as much, I think, as in some countries, like, say, rural Cameroon. I
Yes,
think where
yes,
women
rural,
are
yes,
actually much more connected, probably, than as a community than women here
yes,
in Canada or the US.
exactly. But I think it's as time goes on with all these communities coming together, I think it's getting a little bit better, right? It takes all of us to join our heads together. I think what I find here is people are associated to a certain group. So if you're in one part of the church, they have their own network, and if any other organization.
There is a song that we used to sing, Where Does Hope Come From? I don't know if you know that song. It comes from you, Lord.
Mm-hmm.
Tell
Mm-hmm.
me
Yeah.
about how your spirit, your soul is nourished and given hope.
Hmm. When I wake up every day, my friends always laugh at me when I send them a message. I wake up in the morning. I want the devil to say, "Oh no, why did she get up today?" Because I have to call the name of the Lord. So I always send them a text in the morning. I'm like, ha, just got up, sisters. I can see the devil hitting his head and say, oh no, why is she up today? Because I am going to rebuke the devil and I'm going to call on the Lord to guide me through this day. And I encourage everyone to do the same because it gives you so much strength. It gives you so much hope, because I'm here today because of all the love God has for me. It gives me peace. It gives me joy. People always ask what the source of my joy is. And I tell them, Jesus, my sin. The antibiotics, a lot of the antibiotics are like azithromycin, erythromycin. So I tell them mine is Jesus, my sin. Because I get that hope by going to by going to God every day in prayer and praising God and singing. And I want to pass that hope to my patients also. Because when you go see a doctor who is happy, you feel happy. When you go see someone who's grumpy, it rubs in whether we like it or not. So that positive energy, it's so important. And my prayer every day is, Lord, You helped me to be a doctor, but above all, you are the mighty healer. Help me heal people. Let it be through you, by your spirit, by your power, either by my words, my actions, just my smile. Let me bring some hope in them.
Mm-hmm. That's beautiful. So what's next, Yvonne? Do you have any other doors opening, or are you opening any other new businesses with your husband? What?
New businesses. So right now we're focusing. My main interest now, right now, is diabetes and obesity. So we're working on doing healthy foods for people with diabetes and obesity, or anyone who wants to live a healthier life. And it's all KFS RX meals. And wherever God leads us. And another thing that we're focusing on also is our faith. We have to, we find sometimes it gets so busy that, we can always get busy with the things of the world. But what about our faith? So that's our goal this year.
Mm-hmm.
Yeah.
Well, bless you, Yvonne, your family, your marriage, your clinic, your book,
Mm-hmm.
your new ventures. Thank you so
Mm-hmm.
much for joining us today.
You're welcome. I feel like singing. What song am I going to sing? I love to sing. Mm. On Christ the solid rock I stand. All other ground is sinking sand. All other ground is sinking sand. That's my rock. Thank you for having me, Bill.
Thank you. Thank